Hello, Karina.
Hello, everybody, and welcome to this Innovations in Policymaking roundtable and discussion. We're going to start in exactly 2 minutes to just give people who are making their way onto Zoom time to get settled. So bear with us. Please feel free to use that time to introduce yourselves in the chat and say a little about where you're joining from. And we can use that opportunity to try and build additional connections between the people who are coming into this session. So we will begin at exactly 3 minutes past.
So, great thing just happened. It seems like we ran into a minor technical issue. So, Valeria, do you think you can screen share from your end and kick out Dominic off the screen share? And then because Dominic's screen just froze. Okay, so while Dominic is trying to get his laptop to operate again, I'm going to take over and introduce us, while also letting people into this chat. Welcome, everyone. It is so nice to have so many of you on this call today. I am going to be winging it. So, as you all know, we're here today to be talking about innovations in education policy making. But before that, I would like to tell you a little bit more about Salzburg Global Seminar and the Education Policy Makers Network that is organizing this session today. So if we could move one slide. So Salzburg Global Seminar is a non-profit organization that was founded in 1947 with the mission to challenge current and future leaders to shape a better world. We are operating out of Salzburg in Austria, but also have an office in Washington, DC. And together here with my colleagues, Dominic Register and Valeria Chernish, we work at the Center for Education Transformation, where we convene in person as well as these lovely online programs with an approach to be inclusive, interdisciplinary, intergenerational, and international. Can we move on? Exactly. And this program in and of itself, the Education Policymakers Network, is convened in partnership with the LEGO Foundation. It has been running for about 2 years now, with regular online programs, but at the same time, it is part of a much bigger organization where we organize programs on different education themes, such as social and emotional skills, psychosocial support and well-being, ecological education, inclusive futures, language of instruction, as well as education leadership. At the center, so you can see those 6 areas of interest on the slide, and at the center, as I already mentioned, we convene online and in-person programs, but also organize writing residencies. We host regular lectures similar to this one. Hi, Grace. As well as organize incubation workshops, and we regularly publish articles as well as other publications through our education transformation channel. You can find all our work on our website, as well as by following us on social media with the hashtag SGSEdu. And I think we have one more slide. No, we don't. Wonderful. So now it gives me enormous pleasure to hand over to our first speaker, Beth Bai, who is joining us from Connecticut. Beth, could you introduce yourself, your group,
Sure.
what you'll be talking about today?
I'm so excited to be with you all. I'm looking forward to the spring convening. And it's both exciting and a little intimidating with all these great education policymakers on the call. Corinna, while you were speaking, I couldn't help but think how today's talk really fits in the psychosocial support and well-being that for decades people have sort of separated sometimes from education, and they're so intricately related. I'm really thrilled to be joined by my colleagues Lorna Thomas-Farquharson and Luz Rivera, because in my agency, they help oversee the programs, 2 of the programs that I'm talking about today. So I'm going to share my screen, and hopefully you can all see my screen here. So we really believe we represent the Office of Early Childhood in Connecticut. Connecticut is a small state in the United States of about 3.5 million people. I know that's maybe it doesn't feel small to all of you. And probably we have about 180,000 children under the age of 5. And our office is charged with the education and care and intervention and resources for families with children under 5 and early childhood education. We call it early childhood development in our state system. Our vision is really grounded in equity and access to education and services, understanding how important those first 5 years of a child's life are. I wanted to get us grounded with a video from just 1-minute video, because as Monica and Renan and Corinna and Dominic helped us prepare, they really said, we've got to really feel what you're talking about. And I thought this 1-minute video really did a great job of that. So we're going to use all of our skills here in Connecticut today to keep this interesting and bring multiple voices. Let's see. Can you all hear?
What do we want for our children? What's our goal? Our goal is to have productive citizens that are going to be part of thriving communities. So how do we get from here to there?
As we grow up and as we move into becoming functioning members of society, our mental health is an important part of how we perform our responsibilities as adults. Mental health can't be separated out from cognitive development and language development and kind of social competence, and they all have their roots early on in either a very sturdy or a weak foundation.
We certainly know that infants and very young children can exhibit behaviors, emotional behaviors, motor behaviors, which are predictive in certain cases of subsequent mental illness.
So I think they do a really good job of just reminding us that those early years are the foundation for later growth and can have a big impact on later outcomes. So in Connecticut, in the early 2000s, we realized we had a big problem on our hands in that children were being expelled from preschool at 3 times the rate that children were being expelled from K to 12, and many more suspended or simply asked to leave programs. There are some estimates that for the unreported cases, it could be up to 10 times more than in the elementary schools. And we know this is going on not just in Connecticut, but across the United States. And likely you're seeing some of this in your country where parents are reporting more challenges. And the providers do not feel like they have all the skills they need to work with children presenting with behavior problems. So in Connecticut, we knew we had to do something. And what we did was we implemented a program called the Early Childhood Consultation Project. So this was very much clinical supports that would go in if a child was really, really impossible to handle and at risk of being kicked out of their early childhood education program. We had clinical staff that would go in and work with the teachers, observe the child, work with the parents to help. And to give you a sense of this program, there was a national radio show that featured this early childhood consultation program in Connecticut that I think really you'll hear what it's like and what it did for children. And I've got to do this trick again because I'm sure that somebody more skilled could do this quicker than I, but hopefully just let me know you hear it. Somebody Corinna, give me a thumbs up.
Is there a link that you could send me and I could try to screen share?
I think that what might work is if I do this. Let me try one other thing. And let me know if you can hear it.
It's playtime for Miss Terry Walker's preschool class. They're bouncing off the walls of a small YMCA gymnasium in a low-income neighborhood of Bridgeport, Connecticut. While most kids play tag, one boy wearing bright orange socks heads straight for a crate in the corner. There, among the balls and cones, he finds a long plastic stick, and he starts swinging it at the nearest child. Miss Terry, as the kids call her, quickly steps in, but listen to how she does it.
It's too high? Okay, let's put it low. All right, there we go. High five.
In many preschools, the words no, stop, and don't get thrown around like glitter, but not in Miss Terry's class. Instead, she turns the boy's stick into a game, a bar that he and soon everybody else wants to jump over.
Oh, yes! Did it!
Social worker Maria Santos, who's been watching and coaching Miss Terry, can barely contain her excitement.
That's like the perfect example of gentle redirection and, telling children what to do instead of what not to do, right? Because that's how they're going to learn better.
Santos is part of a program run out of Connecticut's Department of Children and Families that's meant to help any pre-K teacher or childcare provider in the state who's having trouble with a disruptive child. It's called the Early Childhood Consultation Partnership, or ECCP. And before we get to how it works, it appears that it does work.
The children who got the intervention had a significant decrease in the types of challenging behaviors that are likely to lead to a classroom expulsion or suspension.
That's Walter Gilliam at Yale. He and his research team have studied the program for years and just published their latest findings. While it's tough to know if ECCP has long-term benefits, the short-term results, just reported in the Journal of the American Academy of Child and Adolescent Psychiatry, were impressive. That doesn't surprise Michelle Genest. She's assistant director of childcare at that Bridgeport Y and calls ECCP phenomenal. Because so many kids there struggle with poverty, hunger, and trauma, Genest says, disruptive behavior is a common challenge.
We've had children attempt to run out of the building, throw furniture. We've had children severely injure other children.
Still, Genest says, suspension never makes sense. And she sees ECCP, which costs just over $2 million a year, as a vital investment in the mental health of Connecticut's most vulnerable kids.
Okay. Can you all hear me now? I'm doing okay on this. I'm a toddler teacher. I'm not generally a technology specialist. But I'm using this. I was a director that used this program when I had children in danger of being expelled, and we had lots of resources and tools, but bringing in someone with that expertise to train my teachers how to work with children who've experienced trauma made a really big difference. But we realized pretty quickly that this is an expensive program and it only serves kids at the very top of the social emotional needs, whereas what we were thinking about in Connecticut is how do we help create environments in our schools, our early childhood schools, for all children to support their behavioral health needs, because we could prevent some of these problems if we had more help. I'm just reiterating here some of the findings, which I think of children who are at risk of expulsion, these kinds of interventions really helped prevent the expulsions. But we wanted to get before we got to the expulsions and thought, how can we do this and reach more children? And so as a state, we've moved toward supporting all early childhood classrooms with information about how to deal with children's, first support healthy emotional and social development, but then how do you tier those supports? And I'm going to turn it over to Lorna. And Lorna, you can just tell me when to change the slide around the pyramid.
Certainly will do. Thank you so much, Commissioner, and thank you so much to all of you for this opportunity. If we may have slide 10, please, or the next slide, please. And so as Commissioner Bai was describing in terms of ECCP, the Early Childhood Consultation Partnership, that is a targeted approach. That is where an implementation intervention, that is, where there has been an identified challenge, and we have consultants that go into the classroom to work to address the challenge. We recognize, though, that there are moments where you need to intervene with a specific target, but as we talked about, it's important to have a wide brush approach. It's important to be able to intervene and apply, the one slide prior to, please. It's important to intervene and provide interventions in a proactive way. So instead of being reactive, being proactive with implementation. If we could just have one slide prior, please. Thank you. And so
this one?
That one, yes, right there. And so that right there introduces the Connecticut Pyramid Partnership, which again is a way of having a wide brush approach of intervention, as opposed to being specific when a challenge has been identified. This is a way of providing services before it gets to the point of having to be reactive. The pyramid model is a proactive approach, again, appealing to the general population. And its intent is to mitigate challenging behaviors, those behaviors that may be challenging in the classroom. As we know, many have spoken of behavior is the language of the child. So when we hear and see them speaking and communicating, it's important to intervene in a proactive way. Now, when you think about the Connecticut Pyramid Partnership, if we could go to the next slide, please. There are 3 tiers. And when you think of interventions, we know that we typically view them as primary interventions, secondary interventions, and tertiary interventions. Primary interventions we know is more of a wide brush, appealing to the general population, whereas secondary interventions is recognizing those that are at risk, high risk, and trying to intervene at that particular time. And tertiary interventions is when we're trying to now decrease those challenging behaviors. And that is the approach that the Connecticut Pyramid partnership takes, that is. It's first off wanting to expose all classrooms to the benefits of learning, and in particular, social emotional learning. That is the crux of the work with the pyramid work, because as referenced in the previous video that Commissioner Bai showed, when it comes to mental health, when it comes to behavioral health, laying that foundation early on is key in terms of helping to promote healthy development for children. So Connecticut Pyramid, the pyramid model that is, helps to implement that foundation or secure that foundation early on to all who may have the benefits of receiving that. So in the classroom, that is where the level of support and intervention is provided. And when it comes to the level of support and intervention, it is important to know that it is a kind of a parallel congruent process. It's not only providing services to support the child, but more importantly, it is working with the adults and teaching the adults how to enhance their leadership skills, how to enhance their social emotional skills. And so with that, we have a video right here that is giving a sense of what this is about.
The pyramid model is a framework. It's a framework for how to go about teaching children social emotional skills and meeting the social emotional needs of children. When children learn social emotional skills when they're very young, it will help them in everything they do. It's going to help them not only go to school and be successful in school, but be happy. And when people are happy, they thrive.
So we teach arithmetic, we teach writing, we teach all these things, but we don't teach kids how to manage or label or identify or deal with their feelings and emotions in appropriate ways. We expect them to just figure it out. The pyramid model creates a set of practices and structures that allow families and teachers to help their children understand the dynamics of social emotional development and figure out how to manage those day-to-day interactions in appropriate ways. We know from research that when we apply the different evidence-based practices and strategies that comprise the framework, that within the base tier, which looks at supportive in relationships and predictable environments, that about 80 to 85% of behavior issues and concerns are resolved just by making the environment predictable and reinforcing and safe for kids. When we look at that center tier, or that one that looks at teaching specific skills, we can resolve about another 10 to 12% of those behaviors and issues just by specifically teaching a child, here's how we sit, or how to move from one activity to another in a way that is acceptable to everyone else around them.
Okay, so that gives you a quick, I gotta reshare here. That gives you a quick view into the pyramid model. And what we've tried to do here is provide the links so that you can watch the longer version, but we just want to sort of explain how we've gone from this very focused intervention to now trying to work with teachers across the state on a broader level. And Lorna, you can take it from here about our outreach efforts.
Certainly, and if I may, I have to just highlight a very impromptu experience that we've had this morning. Karina, you did not realize that you were going to be a part of our presentation this morning. With us talking about the importance of social emotional learning and starting early on with those early years, that's because we know those little people are going to grow to become adults. And Karina, with you on the spot having to take in when you said, oh, I'm doing this on the fly, you did it well. And that highlights the benefits of being able to regulate our emotions emotions as an adult. And that's what we're striving to do with children as well, because they're not born with that ability. They're taught it, they're role modeled it. And so thank you, Karina, for helping articulate that in this presentation this morning. And so what we see here is a monthly newsletter that goes out to over 5,000 families and providers in Connecticut that talks about the pyramid model. But it's important that it's not just talking at the family members or the providers, it's talking with them. It's validating the experiences they have, the moments where they may be frustrated, but it's giving solution and focused way of how to respond in those ways. Again, what is very important with the pyramid model is that it's about building the adult skills and competence so that they're able to support children in their social emotional learning and health. Next slide, please. And so we know that there is a need. All of us, although many of us here are representing countries around the world, there is definitely one common thread we have, is that we experienced the pandemic, a global pandemic that impacted all of us around the world. And there was a survey that we did here in Connecticut with parents, wanting to get a sense of what are their concerns that they are witnessing or observing with their children. And without fail, the primary concern that they have is the social development of their children, second to the emotional and mental health of them as well. And that just further validates the importance of implementing these skills early on, because right now it's not just a matter of being proactive. Unfortunately, because of the pandemic, we have to be reactive and capture and address many of the challenges that the pandemic did present to us. Next slide, please. Oh, pardon.
Well, I was saying thank you, Lorna, because I just want to come back to this very quickly to say that I don't know what this would have looked like 10 years ago, but at OEC, we are in partnership with families, and Monica will tell you this. You know, when you work in early childhood, you have to be in partnership with the families, and the families don't necessarily know. They don't get a book about how do I support my child's social and emotional development. So this really shows it. If you ask parents, what are you worried about? They are worried about their child's social and emotional development. So at OEC, at our agency, we had to listen to that and try to adapt during the pandemic to give parents tools to help them with that. So I'm going to now hand it over to Luz Rivera, who's been doing incredible work here at OEC with the Sparkler. So if you introduce Sparkler, Luz, and then I can show the quick 1-minute brief about it.
Excellent. Thank you, Commissioner Beth. Along the lines of supporting parents when they have questions and concerns about their children, we have the opportunity, right, to share with them the Sparkler mobile app. And we know that parents have phones handy, and so they can access this tool to engage them with their children birth to age 5. So Beth, Commissioner, if you don't mind sharing the 1-minute video, that will be great.
Did it switch to the video screen or no?
There is this screen, yes.
It's looking at, I feel like it's acting like it's still on the main page. Let me try one more thing. Sorry about this, people. I knew there'd be some challenges. Nope, it's still doing it. All right, let me try it from here.
We can definitely see your browser screen, Beth, if that's.
Oh, you can?
Yeah, we
see-
can. Yeah, we can.
So
Exactly.
if I,
All parents want the best for their young kids.
are you seeing the video?
Yeah, but if you would make it full screen.
Yes,
that would be
I
even-
will.
Exactly. Amazing.
Okay.
Thank you.
Sparkler can help for their young kids. Sparkler can help. Sparkler is an app that helps parents and caregivers understand and support their kids from birth through age 5. Answer simple questions and get a custom report on their development. Get ideas to spark their learning through play. And get coaching from experts right on your phone or tablet. The Sparkler app is free for Connecticut families. Learn more and download today.
Okay, Luz, I'll get the other screen back. And there we go.
If we can, there you go. Thank you. So let me share with you some of the features that Sparkler has to offer for parents at their fingertip. So Sparkler has both the ASQ3 and ASQ social emotional developmental screeners. And so that allows them to answer questions across different domains around their child's development. And so it's automatically scored in Sparkler. And so that allows them to understand where their child is in terms of their development and social emotional well-being. And so ASQ has been around for over 3 decades. It's a standardized screening tool and is validated and reliable. Next, please. And so Sparkler also offers a library containing over 2,000 parent play activities for parents and providers to promote different areas of development that they may have questions. And also it offers parent tips, coaching, and the unique feature of Sparkler mobile app is the direct access to United Way 211 child development, where they have access to care coordinators to support them around their child's development, and access to programs like the ECC program, Birth to 3, home visiting, and beyond. Next, we started with 6 communities, and now we are in 90 communities across our state with at least one program implementer in each of these communities. We also continue to do extensive outreach to both parents and providers and provide onboarding training and support. Next. And our impact has shown an increase of screening completed by parent. And one of the things that we've noticed at the peak of the pandemic, for the first time, parents are completing the ASQ SE at a higher rate. And so,
and that is the social emotional part of it, right, Luz? That they are starting to say, oh, I want to check out their social emotional development. So, and the other thing, Luz, thanks to your leadership, we were able to give this to every family in Connecticut because of the pandemic. Kids weren't in school. The parents didn't know what to do with the kids. They don't necessarily understand child development. We saw that we had way fewer children referred to our Birth to 3 program, which is our early intervention for children with disabilities. And so this connected them, as Lou said, right to that system if their scores were way off in terms of where they should have been developmentally. So go ahead, Lou, sorry.
And so I pass it to you, Commissioner Beck, to share about the unique collaborative partnership in our state.
Sure. Thanks so much, Luz. That has been a big lift for you. But I think what Luz was trying to say before and did say is this is all connected. So if a parent does the app, it goes right to our screening system, you know, our child screen system that's set up to find children with disabilities or that may be at risk for disabilities or families that might need help with home visiting. And so all of these pieces connect to the schools. This is our State Department of Education. This is our disabilities. And we have a 211 call. Parents can just call 211 if they have questions about their child's development. This all connects. The people that develop Sparkler for us work with our people who help us with Pyramid and ECCP to make sure these systems are all connected if a family needs help and support. So it's just a story of how we move from focus intervention to support children's education to really integrating social emotional development into our early childhood system in Connecticut, and then realizing that parents too said we need information. And so we developed a tool for that. So there's just this sort of broad-based information about child development and assessing child development in our state that sort of developed over time. And I'm sure you all had things develop over time with the pandemic as well. And we really thank you for your attention. And I know that Monica and Rhiannon are going to respond and talk about what's happening in their countries. And I can't wait to hear what's happening in some of your places. on this important, psychosocial support and well-being part of the education transformation. Thanks so much, Dominic.
Beth, Lorna, Liz, thank you so much for sharing the amazing work which is going on in Connecticut. We're going to pass straight to Monica Lüdke-Entrup, who has a similar role to Beth, but in Lower Saxony in Germany, who's going to offer some reflections about how their system is evolving and some comments on how Connecticut's model might apply to Lower Saxony and vice versa. And then we'll do the same with Renan Canario, who is the Secretary of Education in Rio de Janeiro, and we'll then open it up for broader discussion. So if you have any questions specifically for Beth or for Monica or Renan, then please post them in the chat and we'll try and cover as many questions as possible. Equally, if you've got resources about early years provision or SEL provision for pre and primary school in your system, which you'd like to share with people, then please just put the links in the chat and we can make sure that everyone gets a download of all the resources that are shared afterwards. So Monica, over to you. Thank you.
Monica, you're on mute.
Yes. Okay, here I am. While I quickly introduce myself, I'm asking Corinna or Valeria, I sent you a photo by email. If you could present that into the Zoom conference, it would be helpful. My name is Monika Lüdke-Entrup. I'm head of unit for early childhood education in the federal state of Lower Saxony. Lower Saxony is one of the 16 federal states in Germany. And we have and we have about 8 million inhabitants, and I'm working in the Ministry of Education, which is in charge of both early childhood education and school education. And while listening to Beth's presentation, I thought, oh, we also have the pyramid principle here. And we even chose the same colors for the different levels. And what I find fascinating, getting into exchange with all these other experts from all over the world, is that that many ideas are there and they need to be transferred into policy making. And what seems to be the situation in this case is that in Connecticut, a bunch of clever, smart people dedicated to improving the situation of children came to basically exactly the same conclusions as my colleagues here in the Ministry of Education. And I'm pretty sure, Beth, that none of us, of my colleagues, ever had a chance to travel to Connecticut and find out what you are doing and vice versa. But it's reassuring to realize that if different people in different countries come to the same conclusions, they must be somehow reliable and a basis to build on. So unfortunately, I have no translation into English. We never expected to go international with this system, but here we are. And we also have universal prevention, which is basically that we train all teachers and make them aware that social and emotional development is something that is very important. And if there's a lack of social and emotional competence, it's of course not very good for a classroom situation. So there's at least at the level of schools, starting from primary schools, there is an increasing awareness of teachers that they can only teach the subject matter properly if the children are with them and are not working on problems that come from emotional stress or socially challenging situations. So we also have universal prevention as the first level, and that's classroom-based. So you have the professional training of teachers, you have classroom management, you have proactive strategies, how to see who needs help and how to address it, but not on an individual basis, but in the classroom group environment. And you need, of course, peer-to-peer counseling on certain cases so that there's a shared vision on how to deal with needs for social and emotional learning at the school level. And as Beth said, parents are just key. You need to get the parents on board, because it's the family that shapes the child. And if there are problems or conflicts, you need to work on them together to give the child the right environment to grow up and to be resilient and to be able to cope with challenging situations. Also from the point of pedagogy of plurality in terms of their different views to things, and every view is okay, but you need to find ways to negotiate in the group context what is possible and what is not possible, and what is to be tolerated and what is not. And you really need to look at the whole learning environment, starting with the teachers and their role model and their way, how they interact with the children. And it moves on to how you structure the classroom, how you paint it, how you place the chairs and tables. And you need to really make sure that well-being of the children and early preventive intervention makes sure that children sort of are part of the group and are taught in a way not only to teach them calculus, but also to make sure that they have the emotional and social stability and awareness that they're able to care for themselves and for others as the fundamental basis for good learning. So we have also in green something you called secondary stage. We call it the first intervention stage, where you need to address children on an individual level, and you have conferences with their parents, with other teachers, and you come together as a team at the school to address how a child can be catered for, and how to also increase the work you do with the families and the parents of the children. And then you have the third level, which is intensive individual support, which is where you really have to make sure that you outreach into the children's environment. So that goes beyond the level of the school. And you also need to coordinate the efforts with the children's environment beyond the family, also into the realm of social policies at their place where they live. The gray arrows next, left and right, they are the supportive structure where you have counselors coming into the schools and also coordinating in cases where children need individual help. So this whole sort of pyramid scheme we have in Lower Saxony here is accompanied by the structure for counseling and also qualification and professional development. And it's also cross-sectoral, so that schools can also tap into social services through centers, regional centers, which sort of help schools to sort of get everybody on board, and also who set up the professional training for schools and everybody working at a school with children, be it a social worker or a teacher. So as you can see, we came to similar conclusions and to a similar system. It's fairly new, so we are rolling it out, but it's not project-based, it's system-based. And I think that's the important thing. Projects sometimes have a limited lifespan, and you need to integrate these things into the system, starting with teachers training and the supportive system, and also how you set up the classroom and how you enable children to learn as a group together, and while respecting their individual needs and their individual biographies, and also the conflicts and problems they carry with them. So yes, so that's what my ministry is promoting at the school level. And now I leap back to early childhood education, which is the part is the area of education policies which I work on. And we have looked at social and emotional learning from the point of view of curriculum development. And we have integrated social and emotional learning into the curriculum for early childhood education. And we have basically said that a child needs to be healthy, happy, in order, and of course not hungry, in order to be able to learn. And if the well-being of a child is core to early childhood education, then first of all, you need to make sure that the child is feeling well being in a daycare center. And that means that also the professional staff needs to feel well, because an educator who has conflicts by himself and doesn't know how to deal with them is not a good role model. And especially in early childhood education, the role model the young children look up to are extremely important. So we have said that a good communication is key, and working with the families is key. And it is that children need to be in good relations with everybody at the daycare center, in their families. And the relations may not be conflict-free, but they need to be good relations where people are authentic, they are true, they are honest, and they care about the children. And this sort of professional attitude is in early childhood education curricula a key to teaching everything else that a child needs to learn, starting from like counting to speaking to learning different languages and all other things. So to wrap it up, I think social and emotional learning needs to be tackled in different ways at different stages of our education system, but it needs a basis on which everything has to be grounded, and a basis which can make sure that children are enabled to actually strive and learn and tackle the challenges that are sort of part of school life in a constructive and productive way that give them good feedback and all the stimuli they need to learn and to grow.
Was fantastic, Monica. Thank you very much. It's always fascinating to hear the points of contact and divergence between different systems and the different routes to get to similar conclusions. That's been an absolute, I think, highlight of working with you all over the last few years. It now gives me great pleasure to bring Renan onto the virtual stage. Renan is Secretary of Education in Rio de Janeiro and is going to offer a similar set of reflections to Monica in terms of how the Connecticut policy connects with initiatives within Rio. So Renan, welcome. Thank you for being with us.
Thank you so much, Dominic. Thank you, Corina, and everyone from EPN, Salzburg Global Seminar. Beth, what a pleasure to hear from you. Amazing stuff going on in Connecticut. Sounds very exciting to hear from Monica, our big leader here, and who is able to connect with so many different policies and intersections that we all have. I was thinking when Monica and Beth was presenting about some things that we have here in Rio and then we were previously discussing, and other ideas that came to my mind as well. And just a brief introduction, I am the Secretary of Education of the city of Rio, which has the largest municipal public school system in Latin America. We have over 1,500 schools, to be exact. We have 1,549 schools, almost 700,000 students, and over 50,000 professionals, which around 39,000 teachers. So it's a gigantic school system in one city. It's a 6.5 million people city, and so it is big. And because of the cultural aspects and also the history behind the city, it has become the biggest in Latin America. And the closest thing that we have here in terms of what Beth mentioned and also Monica built up are two policies. First one is what we call here the infant development spaces, which are an evolution of nursery centers, because 20 years ago, nursery centers were not even below the education umbrella. And after that, on this past 20 years, they have evolved, and the pedagogic behind and the idea of having a nursery, a development space, an infant development space has grown in Brazil, especially in Rio. And right now I have like a very clear idea of what we want to achieve. First thing, kids needs to stay in school as much as possible. So in Brazil and in many other countries, most kids, they stay either the morning or the afternoon in schools. And in these EDI places, as we call in Portuguese, which stand for Infant Development Spaces, they stay from 7 a.m. to, let's say, 3, 4 p.m., which is not common, right, in the country. They also have like 4 meals at minimum. So they are very well fed and very well nutritious based and so on. The architecture of the space is made and thought to develop kids like skills and so on, and to feel very welcome, so that the community protects that as well. It's like an oasis in the desert many times. So you are in a favela, in a community, in a low-income region, and you have a very good, beautiful school. So beauty, it matters a lot. Making like a beautiful places, right? Like where students, where the communities, they feel welcome, they feel that they belong, they want to protect that. So like this is really important. And also the pedagogy, like there's a very famous Brazilian educator called Paulo Freire. I have a picture of him like in my room. And there's a lot of debates about his work, but it is really simple to understand Paulo Freire once you understand that there's a lot to be taught by the teachers, but also by the students. So it's a two ways like avenue, right? Yeah, it's not that you when you go to a class, it's not that you only give, you also learn a lot from the students. So the idea that it's like a process that we all gain from that. And that's what we try to foster in these places. So this is the first aspect that I want to point out. And together with that, we have our committees of parents and committees of, we have a school committee in which we have the parents, the teachers, the students, they all becoming part of that. And one public policy that is very key here in Rio, and we have advanced a lot that throughout the pandemic as well, is the partnership, the health and education program, as we call. So health education program, in which we try to bring the health care public policies to the schools, because there is no other place in which you can gather students and families so easily than schools. So vaccination programs, for example, Brazil is very well known for having great vaccination programs. We have dark times in the past 4 years, but we are back in terms of like science defending vaccination and so on. And then there we have very high like vaccination rates. I'm talking about like over 95% of people taking the 3 shots of COVID, for example, just to give you an idea of that. And we had this partnership with the healthcare secretary that just in the schools of Rio, you're able to get 100,000 students to be vaccinated for COVID, for example. And the program is not only for vaccination, it's also for healthcare in general. So mental health has become something that we are trying to bring a lot. And it's very similar to this pyramid structure that both Beth and Monica explained, in which you have the skill community, you have the education policymakers and educators in general, and the parents, so you can bring them to the schools. You can share the responsibility. You can share the idea of why this is important. And schools as a way to combat fake news and to make sure like, okay, this is that we can't take for granted how teachers and educators in general, they have a leadership role in their communities. They are respected. In many places, they are the only source of leadership or respect that that community is exposed to. The principals of the schools many times is the only leader that the community knows and respects somehow. That comes from the state level, right? Not from like other from gangs and so on. That we so official like official policies. So like the committees and how this partnership from healthcare and education they are implemented is something that we really care. And the last thing that I want to point out is our partnership that we have here with the International Committee of the Red Cross, which is a program that we call Safe Schools Program. So it's how we make the schools, we have protocols in terms of what can happen outside of the school, and we make like these schools protected. And this is very well connected to the idea of having a pyramid structure as well, in terms of from very young kids to like our adults who are students as well, and our professionals. So we have an operations center here in Rio, and the Red Cross that guides us with protocols. So having clear protocols to make like our schools safe, they are very important. And it can go from having undesirable person getting into school to a fire to or shooting happening, not just terrorism, but also like over violence. That's something unfortunately very common that we have to deal. And so having clear protocol, having pyramid structures, they help a lot to guide that. And having these like other areas, the clinical support, the healthcare expertise into the schools, it is really important. The last thing that I want to point out and give back to Dominic is that I'm super eager to have all these partnerships and ideas, but I'm also very careful about who paid the bill. Okay, so we have to be very careful about that, because in many times, like they always put in the education budget, right? And we have the healthcare budget, we have the security budget, and so on. And so we want to be partners, but we want to make sure that we are not double paying, right? Because sometimes we have a limited amount of money to make a lot of things, to advance on a lot of things. And I mean, I have been in discussions in which people want us to pay for doctors. And like, I'm not doing that. You know, there are physicians that are public physicians and paid from like our healthcare team, and we want partnerships so they can come to the schools. Because otherwise we bring so much to our now plots, and then we don't have a lot of resources for that. So I'm super eager to advance on the partnerships, but to make sure that we share these bills evenly and not in a burden way. So those are my thoughts. Those are my 2 or 4 cents here from Rio. Thank you.
Thank you, Renan. Some really interesting examples of collaboration between different departments in service of children's well-being and education. So what we're going to do now is open it up for questions. We'll do about 10 minutes of questions and then move to the second part of the program. Please feel free to put questions in the chat. To kick things off, I'd like to start with a question from Melissa Wong. I think that came just after Beth's and the Connecticut team's presentation. And so there was a specific request for impact evaluations, if there are any that you can share. And then a broader question, I think, for all 3 speakers around if there is any gender sensitive content that you have seen or that has come into different policies that relates to socio-emotional development of children and the importance of modeling by both parents or either parent. So yes, any
I love the question.
Thanks, Beth.
I love the question. I don't have data by gender. We do know that both the Early Childhood Consultation Project had very successful outcomes in Professor Gilliam talked about those in the radio piece. But 99% of children at risk for expulsion weren't expelled. We do know they're much more likely to be boys, and particularly African American boys are more likely to be targeted. And Luz or Lorna, do you want to speak to the data related to Sparkler or Pyramid?
Well, with respect to pyramid model, we certainly know the impact has been quite noticeable in that seeing with its implementation, we have seen improved social skills and reduction in challenging behaviors. And again, it's important to recognize, and someone, Monica, you made reference to this as well, the importance of this being a systemic approach. And it's not just singular, it's not just operating in a silo, not just one classroom, not just one teacher. It's important to have it be a systematic way of intervention. And with the pyramid model, that's why they have a state leadership team, which is comprised of individuals from several entities, administrators, educators, parents, community providers, and they meet monthly. And they have a very standardized way of reviewing work that has been done, but also recognizing areas of growth that need to be done moving forward as well, to have more of a wide brush level of intervention. And with a pyramid model, we certainly have seen greater rates of social interactions with peers in the classroom once this piece of intervention has been applied. So there's much more that can be said, but it works. Impact shows that it's working.
And Lorna, maybe we can ask if there's any gender differences when we talk with our friends at Pyramid, and we can get
Certainly.
those to folks. And Luz, did you have any outcome data related to Sparkler in terms of children being referred to services or parents' assessments?
Thanks, Beth. So Sparkler has shown impact in the increase of screening and also direct connection to our United Way, which have access to those programs. Decreasing the number of birth to 3 referrals, also increasing how the providers, the early childhood providers, are supporting their parents. So there's been an increase in phone calls in our centralized access point, and also an increase in screening, as noted earlier, as well as increase of our social emotional screening in supporting parents, our providers, accessing information and resources in our system.
Thank you, Luz.
Monica or Renan, is there anything?
Yes, I don't have figures for Germany or Lower Saxony on the gender question. But what I would like to contribute is that you need to be aware that children at risk can react very differently. There are children who are at risk and need support in their social and emotional learning, and also in their need to overcome certain crises and challenges. And they retreat. They are very quiet in classrooms, but they are the ones who need the help most. And then there are other children who are behaving in a way that is not socially acceptable. And that's also a cry for help. And you need to be able to look at the range of different behaviors, be they gender-based or not gender-based, in order to do a good job. And the question, or the key to the whole thing, is that you don't judge children on, are they behaving in a socially acceptable way, or do they follow my teaching? You always have to look at them with the view of, are they happy? Do they feel well? What's their current emotional state, and how can I contribute that they are in an emotionally and socially good position to learn and to thrive? And I think that is where you need to apply a whole range of categories, be it gender, be it interaction with the group, with the individual. I think it's very important to look at it from a very broad angle.
Yeah, same for me, like very similar stuff. I think we can go to another question.
So Renan, let's stick with you. It's a question from Raido Delaloy from Emory University about the comment you made at the end of your response around paying the bills. And so Ryder's question is, how do you navigate politically motivated initiatives? Because you're following them, because you believe in them, and then governments change, or the foundations that were providing the foundations of the funding changes, or as Ryder has it, is embroiled in controversy. So I suppose sort of coming back a little to Monica's comment as well, how are you making these things systemic rather than linked to specific political initiatives or building cross-party support? And do you have experience of that? And maybe we could take you and then Monica, if she'd like to add anything, and then Beth, bring that question to you, because you have some interesting experience of building cross-party support for these kind of initiatives. But Renan, to you first.
Yeah, I mean, that's a very interesting question. I think like a good idea is to run for office, and then you can like hold on people's expectations. And I mean, for me, as both like someone who have dedicated a lot of time in to become like an expert on what I do, but also like being an also politician, I have learned a lot how to deal with like the different layers. And many times there's a lot of pressures on terms of like what people think they want to advance on that. But once you confront people with evidence, I think like that's a good, it remediates, right? It's like it's a good way to say, okay, those are the facts. And so those are the evidence of what you have done and what we have done. Those are the facts of what places have done and so on. But it is impossible to, and I strongly defend that, it is impossible to disassociate politics to public policies. And also it's not desirable. It is part of the democracy to keep politics very close to public policies, but like in a way that you are very clear on what are the reasons and criteria for advancing with that. And I personally defend a lot that education public policies are state public policies and not government public policies. And to make more politicians and other players closer to the decision-making process and understandable of what is truly needed in those places, it is really important. Trying to advance with a lot of transparency, platforms, a lot of things that people can have a clear understanding of, okay, this is working, this is not working very well. From what I mentioned, for example, I think like both the infant development places and the partnership with the Red Cross, they are well-known in society here in Rio that are very, very hard to destroy them. You know, like they are very hard to destroy. But there are many other things that are not that easy to destroy. And the last thing that I just want to mention is that like to have a firm position, which, okay, I believe this is important for the government to advance, but this is not with us. This is with the healthcare area. This is with the social assistance area. For example, when I got here in the middle of the pandemic, we were delivering foods in schools with baskets of foods, our teachers and principals. I think this is very important, but this is not on the teacher's role. We have other states, equipments, and infrastructure to be able to help socially on that. And I want my teachers to be devoted on teaching and not on delivering food, just to have an example of what are the limits that I believe.
Thank you. I think that point about, bringing in non-political partners into the consortium or trusted allies is a really important aspect of strategy in this. Monica, is there anything you would like to add?
I think a lot has been said that is very important, and I think we have a second round to go. So, yeah.
So Beth, maybe we could come to you for any closing remarks. You kicked off the session. Anything you would like to share, and then we'll move to the second round.
This has been really helpful. Really grateful to my colleagues Lorna and Luz, and to Monica and Renan, and I'm excited for the next session. Hopefully, I think we have a lot in common, and then there's some divergence. And Dominic, as you pointed out, or whoever put the comment in, we all are living in political realities as well that impact what we do. So it's quite something to navigate, and it's really exciting to share our work with you this morning. So thank you for your attention.
So Beth, Lorna, and Luz from Connecticut, thank you very much for the initial presentation, and then Monica and Renan for the responses and reflections, and to everyone else for the comments in the chat. What we're now going to do is move to the second half of the program, which will be a panel discussion moderated by Lee Bray, who's the Director of Strategy and Curriculum for Education Scotland and a member of the Education Policymakers Network, and a number of other colleagues. And Ollie and colleagues have been part of a working group, part of a learning circle or working group exploring some of these topics over the last few months. And so their panel discussion is going to be focused on breadth of skills in a post-COVID world. But Ollie, let me hand to you. Welcome to the stage.
Thanks so much, Dominic, and thanks to the group of presenters that went before us for the first hour. An absolutely, fascinating discussion. Which really, brought home for me both the differences, but also the very, very strong similarities that we face, across the world. And that's been the real strength, I suppose, of being part of this network. And just something that you said, Beth, really made me think that from a policy maker's perspective, and I'm guessing that most people on the call have got something to do with policy, that we do live in a political reality. But for me, the real privilege of being part of this network is that you're able to park that political reality and actually have some really quality discussions about early years education, primary education, and what's important about supporting the lives of children and young people. And it's been a privilege to be part of that. Folks, what we're going to do for the next 30 minutes or so is that we're going to have a discussion between myself and three other members of the Educator Policy Network from Salzburg Global. And we've got representatives on the call from Kenya, from Lebanon, and also from Jordan. We may get an additional colleague that joins us from Tanzania, in a minute. And I'm just wondering if those colleagues, Layla and Grace and Fadi, if you could turn your cameras on so that we can easily see you. And then what we'll try and do is we'll try and bring you into the main screen so that people can see you, and we can bring you in. And first of all, we just really want to say, thanks so much for giving up your time this afternoon to be part of the discussion and for all of the work that you're doing. Fadi, we know that you might have to nip off to a meeting, partly through this. So we will ask you all of the difficult questions first. No, I'm just joking. We will ask everybody fair questions, as part of this. But everybody, the one thing that I've learned about education policymakers in the international context is, first of all, and particularly these three education policymakers, is first of all, they are absolutely passionate about improving the lives of children and young people within their countries. Secondly, they are incredibly generous with their time in terms of sharing their expertise and ideas with the wider group. And thirdly, they really like to talk. So as part of what we're going to be doing this afternoon is we're going to be holding you all to very, very strict timescales when we're trying to answer some of our questions, so that everybody has an opportunity to speak and do this. Now, when I was looking through the guest list, and it's great to see that we've already got many people on the call. We've got 70 or nearly 70 people still on the call, around that. I was counting it up earlier, and I counted from what I could tell just from the introductory chat, over 20 countries represented here. And some of these countries will be similar to Kenya, Lebanon, and Jordan. Some of them might be similar to my own country, which is Scotland. But of course, within this, we've all got different differences and similarities as well. So what we'll do, just at the start of the discussion, after we have a chance to introduce ourselves, we'll just explain a little bit about each of the country contexts, so that we can understand that a little bit more, and then we'll get into the questions. Okay, so just to kick off, and I'll maybe start with you, Layla, if that's okay. But I'm just wondering if you could just spend just 1 minute quickly introducing yourselves. We want to know who you are, where and where you're working at the moment. So just first of all, just a little bit about you, and then we'll talk about Jordan in a second. So over to you for 1 minute.
Yeah. Thank you, Ollie, and thank you, everyone. I'm Layla. I'm Layla Abu Qattousa from Jordan. I work in the Ministry of Education as an educational supervisor. I also work in UNICEF as an educational consultant, providing consultation related to education in refugee camps and in the host community. I have been involved in the passion of education for 20 years so far. And hopefully this passion continues so that we can provide better quality of education for our students.
Fantastic, Layla, and perfectly on time. Okay, Grace, can I ask you just to introduce yourselves to the audience that we've got today?
Thank you very much, Ollie, and good morning, good evening, good afternoon, everyone. Always a pleasure to be in this space. And my name is Grace Ngugi Maina. I come from Kenya, and I work for the Kenya Institute of Curriculum Development, an agency of the Ministry of Education in Kenya that is mandated to develop curriculum and curriculum support materials. And one of the things that the government of Kenya expects us to do also is to identify salient issues that the Kenyan society grapple with on a daily basis and make sure that those issues are well integrated in the curriculum. And we call them pertinent and contemporary issues. So the topic of our discussion today, which is the impact of COVID on learners' psychosocial well-being, really is one of the pertinent and contemporary issues that the government has expects us to provide interventions on. And I'll be sharing a little more on an initiative that we've undertaken as a nation on this one. Over to you. Over to you.
Thank you, Grace. That's really, again, succinct. That's fantastic. Fadi, over to you. Can you just introduce yourself and tell the audience a little bit about you?
Thank you, Oli. Good day to everyone. I'm Fadi Yarak. I used to be the Director General of the Ministry of Education and Higher Education in Lebanon until last year. I put my suspension of my duties and I joined UNESCO Beirut office as a regional advisor for education for the Arab states. I managed previously several emergencies and mainly the floods of students from the Syrian crisis, as well managing the policies at the Ministry of Education and Higher Education. Now I do work with UNESCO and mainly working on monitoring the commitment of the different countries towards SDG 4 and lately the commitments of the different countries from the Arab world towards their transforming education that they commit in last September in New York in the Transforming Education Summit. So I'm a bit involved now in the global initiatives from foundational learning to the Global Gateway or the greening education, financing education, and gender. It's a pleasure to be with you, and thank you, Oli, for this amazing session.
Thanks, Fadi. And Fadi, we'll maybe just stick with you if that's okay. So I just wondered if you could just tell the wider audience a little bit about the education system in Lebanon. And again, I'm just very conscious that we've got over 20 countries that are represented here. So it would be just interesting, probably just to know the kind of the basic information about when do children start school, when do they leave school, or some of the big system challenges that you've got, and maybe just a minute on that to set the scene.
Thank you very much. Actually, I'll be exposing Lebanon's case. Lebanon has a wide range of education provider in the general education from K to 12. It has the public sector with around 1,200 schools centrally managed, and a private sector, a big number of them, around also 1,600 schools, a big number of them are faith-based organizations. And but they are private schools in terms of they take tuition fees from the parent. Lately, Lebanon is under different layers of crisis, and the last one is the economic and the financial crisis, which has a devaluation of the money. So now, if you ask me what is the major challenge, is the teachers, how to bring them back to education. They are on strike. We have a huge learning loss, COVID, strikes from teachers, and then the financial crisis. And meanwhile, for the last decade, we had to respond to the Syrian crisis with over than I would say 1-to-1 child hosted from Syria and early age mainly. So we're involved in this education policy maker network with Salzburg Institute initiative, and the issue is the best of skills. Why it is needed for a country like Lebanon, and the good news is that we just have a social and emotional learning framework. It was adopted by the ministry, one of the USAID initiatives in the region, and World Learning / Kitabi project developed this social and emotional learning framework for Lebanon. It is needed because children with the learning loss, with a lot of stress, with all the environment they are living, displaced refugees or national students, they need to get the basic skill that would help them to continue their education. So we don't leave anyone behind, and we reduce the dropout, but also it will give them opportunity for the future and enhance their capability. Thank you, Oli. I know that I took more than what you need from me.
No, thank you, Fadi. That was really useful around that. And I was going to go to Grace, but Grace has just disappeared from my screen. So Layla, I'm going to be coming to you now. And so I just wondered if you could just tell the audience a little bit about the situation, you know, and the setting in Jordan. And I suppose it would be great if you could talk about Jordan in its totality. But I know that you work in particular with children that are displaced in refugee camps. It would be good to hear a little bit about that context, you know, as well.
Thank you, Oli. Well, I would like to begin with referring to the situation in general in Jordan. As you know, in all systems, we have kindergarten, primary, secondary, and so on. So it's the same in Jordan, but one major challenge that we have is that kindergarten education is not obligatory. So this is due to the fact that the government cannot cover all the areas with public kindergartens. So people with low income are unable to admit their kids into kindergarten in many areas. So this is one major challenge in our education system, and this is one target of work that is being addressed, the provision of kindergarten all over the country. Also we have the compulsory or mandatory education from grades 1 to 10. Then we have secondary education, where we have two main streams, academic and vocational streams, that is branched actually into different specialties. In general, in Jordan before COVID, there have been several challenges that also doubled or became greater even after COVID, including the crowded classrooms that we have in Jordan due to a large number of students which resulted from compulsory migration due to wars, political chaos, natural disasters in the region. Also, the limited natural and economic resources that hinder also the education in Jordan. So the infrastructure, especially in the public schools, is poor. And this also prevents improving the quality of education. Finally, we have also a very, let's say, critical challenge or serious challenge. It is the teachers' migration from the public sector into the private sector or even to other professions. because teaching has become less attractive profession in Jordan, or they sometimes migrate to the neighboring countries, especially the Gulf countries like United Arab Emirates, Saudi Arabia, or any other country that provide them with more income and better chances for improvement. These actually challenges doubled in Corona and resulted in severe, let's say, learning loss. Learning loss in Jordan is estimated with 1 year, 0.3, and the government is aware of that. And luckily, there have been strategic plans to address this issue during the pandemic and after the pandemic. So in order to address the learning loss, the curriculum department, in addition to the National Center of Curriculum Development, developed a document which has the critical concepts for each grade. And teaching was modified to fulfill these concepts. Manuals were created so that teachers can use them to make sure that when education is continued or is pursued, these concepts are taught to children so that they are not missing years of study. In addition, reflecting on psychosocial, let's say, support for children, the government has been aware of the impact, the devastating impact of COVID. Due to the lockdown, children were plugged at home. They could not interact or communicate with their peers or classmates. Some of the children even experienced the death of one of their relatives or dear ones. And finally, those who came back to school with learning loss experienced the impact of feeling behind. They felt that they are behind in certain skills or tasks or competencies. So this also impacted them very, let's say, great deal. To make the long story short, what the government did to address this issue is that they first worked on the psychological counselors. So they built their capacities to provide support for the school team. After that, those counselors conducted training for the teachers in the school, how to detect signs of distress, fear, discomfort, emotional problems with children, and then how to provide support for the children through designing activities that are curriculum-based. These activities, at the same time of providing support, emotional support for kids, are also in line with the outcomes and the curriculum standards. So teachers were trained to embed the psychosocial support or the emotional support in their teaching and in the curriculum. Finally, hotlines were made so that parents can also communicate with the Ministry of Education to provide feedback or to express fears or any questions they have in mind. Also, the national TV channel cooperated by sending key messages to parents how to handle their children. Sorry for taking a long time to present that.
No, thanks, Leah. All of that was really interesting, and there was I was reflecting recently on the essay that you wrote as part of a wider set of essays about teacher migration. Because that was a very sort of interesting sort of challenge to me. In terms of my own thinking, is that teachers migrating away either into the private sector or into other jobs, and these additional pressures that we all face within that as well. And I think that Fadi, where you were talking as well, is that well a lot of the work that we've been doing has been the impact of COVID. I mean, COVID has really been a chain reaction into a whole heap of other things on top of challenges that many countries were already facing. And both Fadi and Leila, you've been strong on the refugee crisis in your respective countries, and now we've got an economic crisis and all of the other challenges that go with that. The money that obviously then governments have spent on COVID, which now can't be spent on educational infrastructure. So, so a very complex environment. Grace, I wondered if I could just go to you now, and I just wondered if you could just give us a quick snapshot, of the education system, in Kenya around that. Again, I know it's very, very diverse. It's very unique compared to Jordan and Lebanon, and then in the next round of questions, we'll get on to the interventions around things.
Thank you very much, Oli. The Kenya Basic Education curriculum in Kenya, the basic education system in Kenya is divided into 3 levels. I wish I had an opportunity to present on the screen, but I'll just give a general view. We have what we call the early years of education, and early years of education entails what we call the early childhood, that is pre-primary 1, and that is children who are entering the formal learning system at the age of 4 years, and then at the age of 5 years, they get to pre-primary 2. Then after those 2 years of pre-primary, they move to early years of primary education, which is grade 1, 2, and 3. So the 5 years, PP1, PP2, grades 1, 2, and 3, form the first block of the basic education in Kenya, called early years of education. And basically the focus in that level is to help children to now begin to interact with formalities, because they've just come from home. And the focus is to actually support them to develop social skills, interpersonal skills, issues of routine, without diverging so much into numeracy and literacy. But of course, there's an introduction to pre-numeracy and pre-literacy without putting a lot of emphasis on the academic dimension. So the most critical thing is to help them to understand the environment, manipulate the environment, and more importantly, develop interpersonal skills. So that is early years of education. And then the second level is called middle school education. And under middle school education, we have the upper part of the primary education and the junior secondary. So in upper primary, we have grade 4, 5, and 6. Then grade 7, 8, and 9 forms the junior secondary. And then finally, we have the last block called the senior school. And this entails grades 10, 11, and 12. And this is where children are now exposed to 3 main pathways, so that they can choose learning areas that are in tandem with their personality, their interests, their strengths, and the kind of subjects they choose at this point inform their career choice in future. So we try as much as possible to present a broad curriculum at middle school so that you can expose children to different academic levels, academic disciplines. And in the process, the parent and the learner and the teacher are working very, very closely to make sure that they're able to identify points of strength to the children, so that by the time they're getting to senior school, then they're able to choose subjects that are in tandem with their personality and eventually get into the world of work feeling prepared, because there's no mismatch between their personality and the career they choose. So basically that is it. Then from senior school, they can now go to tertiary, tertiary level, and that could be university or middle level colleges. So basically that is the organization of the basic education framework in Kenya. So I don't know whether I need to say anything to do with COVID-19 or that will inform the next.
I suppose, Grace. So first of all, thanks. That was really useful to get the background. I suppose it would be interesting, for the audience. What are the main things? What are the 3 main things that Kenya as a system is wrestling with since COVID-19? We've heard from the others around teacher shortage, around attendance, around learning loss. Can you give us a sense of maybe the 3 big things that Kenya is facing, and then we'll think about interventions.
All right, thank you. The first one is certainly the issue of learning loss. It was very, very significant because children had to stay at home for more than 9 months. And I guess that really affected the entire, learning fraternity in the world. So the fact that they stayed at home and the kind of interventions were given were ad hoc. There are those who would not be able to access learning through technology. And so they actually stayed. Some of them went home without carrying books because it was kind of an emergency. So there was serious learning loss. And when the children came back to school, both learners and teachers were really grappling with incomplete syllabuses, Some of them were in examination classes, so they were preparing for the exams. And that put a lot of pressure on both the teacher and the learner. But of course, you can imagine the learner bore the greater weight. And so there was a lot of, stress. And especially Kenya being one of the countries that tends to focus so much on the academic development at the expense of other dimensions like the socio-emotional learning, the physiological aspect of the child. So there was that bit. So besides the learning loss, there's what we call the COVID had serious impact on the psychosocial well-being of the learner. And out of a study that we conducted, we actually identified a number of psychosocial issues that learners were grappling with. Some of them, the issue of social relations, a finding that came from a study that was conducted on the impact of COVID-19 on learner psychosocial well-being, indicated that learners had great challenges making connections with others or feeling a sense of belonging at home, because they rarely stay at home with parents. They stay at home for 3 months, and the rest of the time, 9 months, they're actually in school. So there was an element of strained social relationships at home front. They indicated they were missing their friends. In fact, 40.2% of the learners reported they had challenges with their social relation, either at home or even in the neighborhood, and they were missing their own classmates and schoolmates. Then issues of self-esteem, stigma and discrimination, especially if a relative had COVID or the learners themselves had COVID. So the issue of stigma and discrimination was real, and especially for learners who would go to school near their homes. So their colleagues would know that actually either a parent or they themselves had COVID. And but now to go even besides the psychosocial dimension, there's what we call the mental health impact. A study that was conducted by the National Research Fund identified 3 major mental issues that learners grappled with. And the first one was anxiety disorder. Actually, 25.7% of the learners reported that they had struggles with anxiety. And they reported struggling with symptoms like sleep problems, worry, bad dreams, struggles with ability to concentrate, feelings of loneliness, forgetting things very easily, feeling uneasy, easily getting tired. All those are symptoms of anxiety disorder. Then the next mental disorder that they experienced was depression, and 27.9% of the learners who made the threshold for intervention actually reported having struggles with depression. So they would struggle with emotions such as sadness. They would be worried. They were wondering whether their parents have died while they're in school. So issues of sadness, fear, feeling helpless, hopelessness, suicidal ideations, and difficulties with eating. And those are actually very basic symptoms of depression. And finally, there's what we call PTSD. Post-traumatic stress disorder is actually a mental disorder, and 44.4% of the learners who participated in that study actually portrayed PTSD symptoms such as memory losses, feeling on the edge all the time, having trouble sleeping, avoidance and hyper-alertness to safety issues, And but there's a lot that I could say, but let me just identify those 3. There was learning loss, the academic dimension, and then there was the psychosocial issues that I talked about, and the 3 types of mental health learners in Kenya grappled with. I could talk about it in time now.
Well, maybe thanks for that, Grace. That was really comprehensive, and you might not have seen the chat, but Anita and a couple of others have asked whether the research can be shared, and we'll obviously sort of try and find a way of doing that, and we'll maybe come to the interventions that you've put in place in a minute. But before so if you can have a think about that, and we'll come back to that in a second. But Leila, maybe if I just come to you around that. Now, you've already talked about some of the interventions that have gone on in Jordan, and I guess that when I think about like the breadth of skills I don't just think about, you know, social and emotional skills, although be it that's very, very important. I also think about cognitive skills as well. So, for example, literacy, you know, and numeracy, you know, or which are often the building blocks of learning loss over the last few years. And I also think about, you know, physical skills and creative skills as well, which have all been impacted, you know, during the pandemic. So I just wondered, Leila, could you share with the audience, you know, some of the interventions, or build on what you've already said, particularly around those cognitive skills? So what's Jordan been doing to for example, support literacy and numeracy in primary education?
Yes, Ole, before I go to your point, I just want to refer to one important issue. As a consequence of Corona, we all talk about learning loss and psychosocial and emotional impact. There is, in addition to that, something called value loss. So for many teachers, they complained about having difficulties in controlling the behavior of students in classroom discipline, having students to work in a team again, even queuing in a line and waiting for their turn to speak. This is due to, for example, spending many hours at home on social media. There were many behaviors that were seen as undesired ones. So at the beginning, there was a lot of work to be done on detoxing, if I may say, children from the value loss that they have been experiencing due to, let's say, months of being at home and not being able to go back to school. Now, back to your point related to what have been done in order to bridge the gap that is resulted of the learning loss or the lockdown. Well, there have been many, as I referred to at the beginning, by the curriculum department and the National Center of Curriculum Development that is creating the critical concepts and creating the manuals. Now it is a priority for the curriculum department to develop the curriculum so that the new curriculum would address issues that have not been addressed before, or the, let's say, the issues where students are behind due to the COVID lockdown. In addition, there have been summer clubs, let's say, or summer courses for students, especially in the early grades, for their parents as well. They can join so that we can catch up with the concepts that they are missing. Finally, there is actually at the moment kind of efforts being monopolized to accelerate learning. There have been some programs designed in the refugee camps and piloted in the refugee camps, and they proved to be successful. Actually, there is a major challenge in the refugee camps because in the regular days, or during the regular days, there have been great numbers of dropout and early marriages for females, talking about gender sensitive issues here. Students who have been dislocated from one district to another district within the same camp, missing their schools and their time of studying. So piloting these centers where learning can be accelerated and given to the marginalized children have proven to be successful. And now there are efforts being monopolized, as I referred to for the host community actually to benefit from this and to accelerate learning within the class. So activities will be designed in a certain way to meet the needs of different types of students, or the learning activities will be differentiated in order to meet the different levels of the students within the same classroom. I would conclude with shedding the light on early grades, as you referred to the breadth of skills related to numeracy and literacy. Now this is actually a priority of Jordan for the next, let's say, 4 or 5 years, coming 4 or 5 years. So programs are being designed to support these basic skills and to link them to other important skills for other grades, including critical thinking, innovation, entrepreneurship, and so on. But basically, early grades, early childhood is a priority for Jordan at the moment, and we are working steadily towards improving education for this group of students. Thank you.
Leila, thanks so much for that really comprehensive answer and everything that you're doing there. And I suppose just for the benefits of the people on the call is that we're currently working on a set of essays, which includes a short case study on Jordan, Kenya, Tanzania, Lebanon, and Scotland as well, and those will be available shortly, sort of building on this discussion. Grace, I wondered if I could just turn to you now, because you've talked and you've reflected on a lot of the challenges, another one of the holistic skills, social and emotional skills, and I know that in particular your essay that you've written sort of focuses on the interventions that have taken place there. So I just wondered if you could share with the audience a little bit of the work that you and your colleagues have been doing on that at a system level.
Thank you, Ollie. I don't know why I have some echo in the background. Is that okay now? Am I audible? Thank you. Yeah, so this study that was conducted by the National Research Fund, and I was privileged to be one of the 10 lead researchers in this process, wanted to identify the impact of COVID-19 on learners' psychosocial well-being and mental health. Now, out of the 2,487 learners who were assessed, 2,067, that is 83.1%, met the threshold for intervention. So COVID was not a small thing. It really affected very many learners. And 730 learners between 12 to 13 per every school that participated were taken through an intervention, so that the idea was not just to identify the issues they're grappling with, but an intervention was made. And the intervention focused on those with multiple comorbidities, those who had anxiety disorder, PTSD, they suffered from discrimination, stigma and discrimination, or their social relations were really severed. Learners with multiple comorbidities were actually the ones that received some intervention because we couldn't manage all of them. And we went through an intervention process. I do not have the time to talk about that, but I can actually talk about a tool that we adopted. A tool was adopted which was based on experiential learning approach, so that we can establish the knowledge levels that these learners had on COVID, but we also wanted to know the severity, the level of severity of those issues they were grappling with. And what we did is that a tool was actually developed by the same team, and the aim of the tool was to address the PSSMH issues for learners who met the threshold. Specifically, the intervention was to develop an evidence-based intervention tool and then engage the stakeholders in enhancing psychosocial support and mental health among learners. And then finally, we needed to foster sustainability of the psychosocial and mental health initiatives in the schools. That was important because you provide interventions, but there are other people besides the researchers and the project counselors that should be involved. And finally, how do we sustain this so that in the event that there is another adversity besides COVID, student counselors in school, teacher counselors in schools and the teachers themselves can actually provide intervention. So we had the scope of the intervention tool that entailed, addressing psychological issues, anxiety, depression, then self-efficacy and self-esteem, self-awareness and social relations, post-traumatic stress disorder, then addressing how children, we gave them psychosocial competences on how to address stigma and discrimination. And then finally, we terminated. So there were 6 sessions that were actually articulated in the intervention tool. And the counselors were trained, and those learners who had comorbidity, multiple comorbidity issues were taken through these 6 sessions by trained counselors who are trained by the lead researchers who also have background in psychology or counseling psychology, and others are educational psychologists. And besides that, there was what we call capacity building for teachers on psychosocial and mental health. And we trained teacher counselors in every 12 schools in every county. So approximately 120 teacher counselors were trained on psychosocial support and mental health interventions. And those teachers were trained to keep providing interventions to the learners, but the teachers were also expected to train their fellow teachers in learning institutions. And for us to make sure that the training is harmonized and standardized, we developed a teacher's guide on psychosocial support and mental health. And the teachers were taken through training pedagogies, the concepts, the 6 sessions that the learners went through. The teacher counselors were also taken through. Hello. Hello. Am I on? Am I on?
You are, yep.
All right, I'm seeing something to do with NPOL. All right, so this teacher's guide helped the teacher counselors to conduct training for their fellow teachers for 1.5 days, at least a period of 8 hours. And the findings are actually there to indicate how excited the teachers were. So out of the 5 counties, which had 12 schools, and the teachers were trained, maybe this would have been a little easier if I would present. But in total, we were able to train 1,198 teachers from the 5 counties that had been sampled in the, in the study. But there were a number of recommendations that were given, and 2 important recommendations that were given was that there should be practical interventions to help learners effectively address psychosocial and mental health issues arising from adversities in life. We saw how devastated learners were. And because you're not sure, we cannot be sure that another adversity will not come, then proper mechanisms should be put in place. And we are hoping that these findings will actually support key stakeholders to come up with, to upscale the interventions we give in the few schools. Number 2, there was a need to establish referral mechanisms for learners with mental health issues. And we kept telling the teacher counselors that for mental health issues, they may not be competent enough to handle. And so the issue of proper referral mechanism should be put in place in every learning institution. So I think I want to stop here, but I'll be very, very happy. And I promise Dominic that I'll be very, very happy to share the actual research findings once they are ready. What I have just shared are preliminary findings for this wonderful study. I have been in KICD for more than 24 years, but this has been the most amazing study that I've been involved in because we were able to develop interventions and we intervened, and there are very good results out of this. Children are giving very positive response, and the teachers as well. Over to you, Oli, and thank you for the chance.
Thank you, Grace. And again, I was just looking through the chat, and a number of people are very keen that you do share that study. So we'll make sure that we get that, and we'll put that out. There's also some interesting. There's a lot more comments in sort of rather than questions, but some very similarities that people on the call are sort of sharing around different challenges, including some of the challenges to do with sort of teacher migration. We're nearly at time, folks, around that. But Layla, I've just got one question for you, if that's okay. And I think this will just sort of round things up nicely. Grace has really just answered this one with a sort of like closing remarks. But I just wondered, in terms of your work, Layla, and sort of priorities to Jordan, as you continue to sort of develop and work with the system. Could you just sort of say a few words on what are your sort of personal priorities, or the system priorities for the next 12 months to 2 years? Just maybe a minute on that, and then we'll wrap that up and hand back over to the folks from Salzburg.
Yeah. Actually, thank you, Grace, for your but I can hear my echo of my voice. Okay, now it's good. She reminded me, actually, Grace, with a very important priority, that is the training teachers. Of course, teacher training is a main and basic priority to provide the support for the students. Accelerating learning is also a priority for us. And as I mentioned before, early childhood support, the provision of public kindergarten all over the kingdom, so children can be enrolled from the very beginning into regular schooling, addressing the curriculum, developing updated curriculum with the 21st century skills, with the psychosocial and emotional also objectives and outcomes to be achieved, providing education that actually promote learners' skills in critical learning, in also digital literacy. We're talking about numeracy and literacy, reading and writing, but also digital literacy has become a very important priority. In addition, creating friendly to use platforms for training teachers. This would be blended type of learning so that we can cascade large scale training across the country. Finally, of course, maintaining a quality education in the refugee camp, providing education for the marginalized students, conducting research for measuring the impact and the success of our programs. These are the priorities of the education in our country.
Leila, thanks so much. I mean, lots to do around that. I just note from the chat that a few nods to around sort of teacher training and find new, better, more efficient ways to do that. And I also note that your comments around digital skills and digital platforms. A colleague had put up in the chat. So again, all of these messages sort of starting to come together. Okay, folks, I think we're at time for our discussion. That's been a fascinating and very, very quick 45 minutes. So I just want to say a huge thank you to both Leila and Grace for answering those questions and preparing so well for the questions as well. And also to Fadi, who's had to leave the call to go to another meeting, but we'll send him a thank you as well. But we'll just hand over now back to the good people at Salzburg Global Seminar just to wrap things up. But thanks again.
Thank you for facilitating, Ollie.
Yes, let me add my thanks to Ollie, Leila, Grace and Fadi for that fascinating discussion. Today is the International Day of Happiness, which is one of the UN celebration days. I've just put a link to the UN's website for International Happiness Day. And in about an hour's time, I think the 2023 World Happiness Report is being launched. And I think a lot of the concerns and the themes that have come through in both halves of this session will echo in the World Happiness Report, which is one of the reasons why this kind of network and these programs and these opportunities for sharing great practice and innovation in the policy space are so important and so valuable, particularly as that last discussion really brilliantly highlighted after kind of pandemic period in the last couple of years of accelerated trauma that so many different societies and students around the world have had to grapple with. Having these policies that promote well-being, that ensure good learning is happening, have never been more important. So thank you very much to everyone who joined today for the discussion, and particularly to the members of the Education Policymaking Network for being so generous with their time and expertise, and very much look forward to collaborating with you all in different ways as we move forward. So thank you very much, and happy International Day of Happiness to everyone still with us.